Hey, hey, hey. Thank you all very much for joining me this evening on a Wednesday. I am Dr. Dietrich Gorman, America's Relaxation Doctor, on another episode of Relax Well with Dr. Dietrich. So thank y'all very much for joining me tonight. So we don't have one, but we have two, I said it right, two very special guests here with me tonight. And we have two of my super friends who are cardiologists, and how befitting because Friday is February Heart Month, right? I mean, February is Heart Month. So this is so great. And I'm telling y'all don't want to miss this, okay? So you don't want your loved ones to go without this knowledge and this education. So please tag folks to come in, share this live stream. And if you happen to be watching it on the replay, put hashtag replay in the comments. Okay, so before I bring my guest up on stage, my two distinguished colleagues, I wanted to share a couple of fun facts with y'all about the heart. So the first one is did you know that the heart is the first functional organ to develop, and it starts to beat and to start pumping at about 3 weeks into embryogenesis? When I was looking up this stuff last night, I was like, wow, that's totally amazing. 3 weeks, right? Oh, hey, I see a couple people. Hey, Dr. Kadisha. Hey, Yvonne. Hey, Trina. Hey, Kasali. Thanks for joining. The second fun fact is an adult heart pumps about 6,000 to 7,500 liters, which is like 1,500 to 2,000 gallons of blood daily. I mean, that's just mind boggling to me. I mean, just totally mind boggling. And maybe when our cardiologists come on, they might be able to say some extra things too. But it's just so much that this heart does. I mean, in a day. I mean, 6,000 liters. I mean, can you imagine that? And then a third one is stress and anxiety is the most common cause for a fast heart rate, also known as a pulse. So isn't that something else as well? So I'm talking about relaxation, stress reduction, and this is even more important to get your stress better managed, to learn these relaxation techniques that I'm sharing with y'all so that you can, of course, learn to relax but help your heart out as well. Okay? So I love those fun facts, and that's we're going to get to the crux of the show. So let me introduce ourselves, my guests, Dr. Diaz Smiley and Dr. Sanu Corrielus. Thank y'all very much for joining me. I'm going to bring them on, and we're going to get started right away because we have so much information to share with y'all. Okay. Hey, hey, hey.
Hello, Dr. Dietrich, and hi, everyone.
Hey. So y'all hear me okay, right?
Yep.
Yes, yes.
Okay, good. Thank y'all very much for joining me. So my audience don't know y'all, so I want y'all to start off by introducing yourselves and tell me in the audience a little bit about yourself. So I'll start with Dr. Dia first.
Hey, everyone. So I'm Dr. Diaz Smiley, board certified, double board certified cardiologist and internist, as well as best-selling author and fashionista. I'm a cardiologist in Atlanta, Georgia, and I've been practicing for almost 5 years. Um, so not too long, but I've been doing this for a bit, and I enjoy actually all aspects of cardiology, especially cardiology in terms of women's health, which is our main topic today, as well as my specialty, which is imaging. So I do all kinds of imaging, and I'm here to answer your questions. I'm from Ohio, so I've trained in Ohio
Oh,
and
okay.
in Connecticut, as well as Boston, and I'm in Atlanta now.
Oh,
Nice,
wonderful.
nice
Good
to meet you all.
information. Okay, what about you, Doc?
Good evening, everyone. Good evening. I am Dr. Sunil Corrielus. I am delighted, pleasure to be in here. Thank you, Dr. Dietrich, for having me. I am in Philadelphia, the city of brotherly love. So I am, it's really delighted to be here. I am a board certified cardiologist. I am the CEO of Corrielus Cardiology and Suave Concierge Services. Through my cardiology practice, I help men at the prime of their lives to live the best time of their lives while protecting them from dying of heart disease. I do that out of the really the passion that I have in really empowering the community, educating the men to take care of their health so they can continue to leave the legacy of good life, good health in the community. So I know that, we're going to get into a lot of that this evening in the discussions. I'm looking forward to it.
Excellent, excellent. Thank you. So y'all out there, it is not just, this is intentional. I have a woman cardiologist and a male cardiologist. So we're going to delve into both aspects of heart health. So it's very important, of course, without our heart, we wouldn't be alive. And so I just wanted to share this perspective, with these two folks, just so you can hear it from, quote, the horse's mouth, how we need to focus on men's heart health as well as women's heart health, because it's so important. Okay, so I see Dr. Kadisha, Patrick, thank you so much. Stephanie, thank you. Victoria, I really appreciate y'all joining us tonight. So tag folks to come on in, and we're gonna get started. So Dr. Dia, I know you deal with women's health and whatnot. So as far as like heart disease and women's heart health, are there any like special considerations that a woman needs to have, and or as far as like presenting symptoms, as well as far as like how they should pay attention to their heart health? Because I know women can present differently as far as like if they're having some type of cardiovascular problems or whatnot. But can you shed some light on that, how a woman can present with heart issues?
No, absolutely. So this is actually probably one of the most important questions in this live stream, because it can really help a lot of people in the audience, hopefully, and their families detect heart disease earlier in women. So women, present a little bit differently than men. Not all women, but a lot of women do. And so it's very important to know that the classic symptoms of just chest pain, clutching your fists, the horrible chest pain, may actually not occur if they do have, for example, heart blockages or are having a heart attack. And the symptoms they really need to be cognizant of and not ignore is shortness of breath. I mean, shortness of breath could be the only symptom they have, especially when they're doing something, when they're walking, when they're going up the stairs. That's new, right? Because you can have shortness of breath if you haven't exercised for a while, but if it's new and it's getting worse, that could be actually a sign of heart blockage. This is what we call an anginal equivalent. Okay. The other thing that people are more aware of now, I think, because there's a lot of public health efforts to educate women about that, is heartburn symptoms. So not just the feeling of heartburn, but like feeling of chest pressure after, almost like something is stuck, or, stomach, almost like a stomach ache, but it goes up to the chest. And especially discomfort that goes from the chest or the stomach up to the jaw and the neck. That can actually be a sign of heart blockages or a heart attack, especially if it's not going away. And also, just general symptoms. I mean, fatigue, just fatigue of unknown, clear, etiology. They're like, I sleep a lot, and by 3 o'clock, I'm really tired. That's not me. Or, it could also be dizziness, which is usually a sign of a rhythm problem that could happen from the heart not getting enough blood flow. But I think, what I tell my patients is there are other symptoms to watch out for, because the classic symptoms were based on really studies that were done in men mostly. So people don't realize that in the 70s and 80s, it wasn't until the 80s that we started to include more women in studies, really the 90s. And so the studies before that, the Diamond and Forster studies in the 70s, which kind of defined what angina is, what classic angina is, what typical and atypical angina is, was mostly done in men, right? And so women, and especially diabetic women, are even more likely not to have chest pain. They may just feel tired. They may just feel off. And that also occurs in men, but more so to a certain degree in women, especially diabetic patients in general. So that's a very important point. And I do want to point out that I see a lot of women, obviously, because only about 15% of cardiologists are women. So it's kind of like OB. Certain women want to see women. So it's the same thing with cardiology. And I would say around half of them don't have classic symptoms. What we call atypical symptoms. So it's very common.
So on on the same lines, a woman has more estrogen, than a man. How does estrogen like play a role in like helping heart disease, or if a woman is on birth control pills? There might be two separate questions, but how does estrogen have a role with heart problems or
Well,
heart health?
actually, very,
Hmm.
very good point. Like,
Hmm.
women don't get heart disease in general. There are exceptions, but in general, women get heart disease 10 years later than men on average, because their own estrogen protects them. And so there have been a lot of studies done. The last big study was actually that was stopped in 2004 when I started medical school. It was the Women's Health Initiative, huge study, thousands of women, um, you know, and they thought that given estrogen to postmenopausal women or women who had hysterectomies or whatnot was beneficial to the heart. In fact, you may remember Dr. Dietrich, because I remember actually some women taking hormone therapy for, and maybe you remember too, Dr. Sunul, before in the 1990s and stuff to protect their heart. And that big study was actually stopped early because we realized that even though your own estrogen could protect you, premenopause, if you get estrogen from outside, especially pills, that it actually can cause more clots. So that study was stopped because a lot of women actually developed clots in their lungs, heart attacks, strokes. So we know that outside estrogen can cause more damage, and that was actually, I did a lot of research in that area, and so we know that, for example, transdermal estrogen is less likely to do that. But there are other obviously risks to estrogen other than heart disease, like heart attacks and strokes and stuff. It's also cancer, and you can probably talk more about that, Dr. Dietrich. So anytime someone wants to go on hormone therapy, it's a big discussion about risk and benefit. And I can tell you, my patients that I see, because a lot of them, I mean, most of them have heart disease. It's usually no, or hey, you want to take the risk, but be aware of what could happen. So just recently, I had a 95-year-old that had a heart attack, and she was on estrogen therapy for 30 years. And she was like, I'm not going to go off of it. I'm like, hey, you know the risks. And honestly, it took you 30 years to have a heart attack, probably from actually aging, right? So it's a risk and benefit discussion, but we never give estrogen therapy for heart protection anymore. And we are aware of the obviously complications of estrogen therapy. So that's why women usually get heart disease in their 60s, 50s, and 60s, not 40s and 50s on average.
Okay, so I know, like, when I'm practicing, I always kind of get nervous, when a woman says, and I understand they have menopausal symptoms and whatnot, and they want to go on hormone replacement, and I just really kind of cringe about it because it feels like I just don't want to be the one to, cause a problem. So I'm like, I need you to understand, there's definitely risk involved in supplementing, and having extra hormones, and so I make sure that they are totally aware of all the things that could possibly happen before I even think about it. Because I'm like, when I have to go through that conversation. So thank you very much for that information. And y'all who are out there, if y'all have any questions, please ask them. I see some more people joining. Hey Nancy. Hey Estella. Thank you. Hey Stephanie. Hey, Dr. Nino, thanks for joining. My little sis, my doc little sis. So I'd like to start just kind of switch over a little bit for the men, Dr. Corrielus. Can you tell us some special considerations for men and heart disease
Well, one thing.
or heart health?
Yes, thank you, Dr. Jitri, for the question. Yeah, one thing that I would mention is that as in general, men tend to be, less likely to present at the early stage of the disease. A lot of times, men will find reasons not to come to the doctor, right? And the heartburn, oh, it's nothing. I've had pain and aches before, I can ride through that, maybe take a couple Tums, couple Tylenol, and keep going on. So with men tend to present much later in the disease stage, and they tend to be a lot sicker by the time they get to the doctor, right? So as a result, that will lead to much poorer outcome. So we do know for a fact that a lot of times, we have to take a lot more aggressive measures when it comes to the men because of the fact that they present much later, much sicker, and with much poor prognosis. And that's one of the impetus, one of the reasons I'm very interested in men's health, and being able to really be able to intervene early. And we know that the best intervention is really at the point of prevention, right?
Yeah.
So if we can catch the disease, get the attention earlier, the earlier we can, the better we can intervene and make the impact. So that's very critical. We do know that heart disease is a lifestyle disease. A lot of the blockages, a lot of the cholesterol building that takes place a lot of times is related to what it is that we are eating, and also the lack of exercise, the stresses that we are under, and also the lack of sleep. So in general terms, when I talk prevention, I try to touch on all those different points, and try to see, okay, which ones resonate more with one person or another. For some, it's more the stressors, right? So that's where, I probably get them quickly to the American relaxation doctor, right? That's the difference, right? So, and there are some, it's their eating. They just they just like to eat. Some people just like to eat. And when I say like to eat, people have this, they like good. What's good? What tastes good is not always what's the healthiest, right? So the fat tastes good, sugar, fat, and sweets, and so definitely those. Then we tend to do more in terms of nutritional support, get them to a nutritionist, and really help them understand the relationship between what they eat and their health. Really, so we pound on that very, very much, and also the needs for sleep, and also the other risk factors like the smoking and things like that. So we try to address those and try to bring about a more comprehensive approach to health, heart health, and so that we can circumvent the condition, but prior to it being developing. And so for those, and we also raising awareness about the disease, helping them understand, okay, understand their body is just as well. So if they know their body, if they practice those techniques, relaxation techniques, what that will do is will help them understand their body, to know what's normal. And so that when something comes, the symptoms come, they don't just brush it off. They know it's something that's not normal for them, and they will to seek attention. So it's really about coaching them to know, okay, what's normal, what's healthy, and so that they're able to seek the help when something goes wrong, rather than waiting.
All right. Once they get to you, I'm sure you have to show some tough love, and you really have to kind of be it's either a life or death situation, and this is just how it is. This is how it's gonna have to be, right?
Yeah. Yes, absolutely. Unfortunately for men, at least for me, I have to see. You have to see it. You cannot sugarcoat it. So let's put it in plain language, so that they understand what's involved. And it's always good, to have a partner if the partner is there. So try to make it a team approach. So try to really not scare them, but really give them the reality of what they face. Give them the 360,000 view of, okay, what heart disease is, and if they don't do what they need to do, this is what's coming, and so that they can get a real well understanding of really what's at stake, and not just waiting for something to happen when at that time it will be too late.
I know pre-COVID, when I used to see the couples in the clinic, because now we only see, one person, and the guy will be there for his checkup, and I talk about getting a heart evaluation, and the wife is sitting next to him. I get the eye roll, and and then she gives him the glare, and then I'm like, look, it's your life.
Yeah, yeah, yeah,
Okay,
yeah.
so can you tell me, like, males have more testosterone. Is there any type of cardioprotective role for testosterone in male heart health, or is it have nothing to do with heart health, or supplementing people? Males get these testosterone injections. Does
Yeah.
that cause any issues? That kind of
Yeah.
thing. Mhm.
Yeah, yeah. Just like Dr. Dia mentioned, for estrogen, testosterone likewise. We back in the days it used to be like doctors would just write for testosterone like nothing to supplement those, especially the older men with low testosterone. But we understand that testosterone peaks at age 30. So as we get older, our level of testosterone decreases. So it does not necessarily mean that there's an abnormality that we need to supplement testosterone as we get older. And so it's very infrequently done now. And we do have data that suggests that if we supplement the testosterone in certain patient circumstances, there's increased risk of heart attack and stroke in those individuals. So that's why we have kind of, based on the data, moved away from randomly supplementing people with testosterone unless there's clinical indications that really warrant it. But in the majority of the time, if we're talking about preventing heart disease or whatnot, there's no benefit there. There's no reason to supplement those people. So we know that at times people may be experiencing symptoms of fatigue, extreme fatigue, or just muscle waste and things like of that nature. That a lot, and in the setting of low testosterone, it's hard to tell. It's hard to tell, and that's where clinical judgment, knowing a patient, is very important, and to make that distinction and see whether supplementing testosterone is the right thing to do. But for the most part, it's no really clinical relevance to doing it. Yeah.
Well, that's good to know. Thank you. Thank you. We do have a question. I do want to say hi to a couple of extra folks too. I see that Kim started watching. Thank you very much. So Victoria is asking, could one of y'all please explain HDL and LDL? People who are cholesterol and they freak out. So that's a great question.
Mhm.
Do you want to go ahead, Dr. Corrielus, or do you want me to
Go ahead, Dr. Dia.
I guess I'll start, and I guess you can chime in. So that's a very good point. What I emphasize to my patients is really look at the breakdown. Don't look at just total cholesterol, because actually total cholesterol could be normal, but then the breakdown of the HDL, LDL, triglycerides is not great. And so HDL is the high density lipoprotein, which means that that's the good cholesterol. Why do we call it good cholesterol, right? Well, because it prevents plaque from forming in your arteries. Okay, so its job is to take all the cholesterol with it and not let it stick to the arteries, and that is mainly genetic. So HDL is mainly genetic, meaning that you inherit it from your parents. And people don't realize, like, you could be healthy and have low HDL and still have a heart attack at 40. Okay, so how can you increase it, right? Well, the cardio exercise is the most important. We like to see the level above 40. So the higher, not too high, like above 100, there's some issues that happen, but usually above 40, the 60s, 70s, that usually protects you really well. Again, you can't really increase it that much if it's genetically very low, but cardio exercise increases it. Also, eating certain good fats like olive oil, fish, especially salmon, mackerel, and sardines, avocados, nuts. So they're, drinking red wine. So there are, obviously, if you're not a drinker, don't start drinking. I always tell my patients, if you're not a drinker, don't start drinking. It's always better not to drink. But red wine, actually, 1 glass for a woman, 2 glasses for a man daily, is healthy for the heart. But again, addiction, is a problem, so don't start drinking if you can't control it. But it's mainly genetic. So you do all the right things, and you want to look at the breakdown. Hey, is your HDL 20, which is bad, or is it 50, which is not bad, right? Now going to LDL, I guess I'll let Dr. Corrielus explain that. But that's the bad cholesterol, and so that's why it's very important to look at the breakdown.
Yes. Yes. So thank you, Dr. Deer. Your bad cholesterol is the LDL. The LDL, really, that's the level, the LDL particle that really is the one that is going to lead to the plaque buildup in your arteries. That's going to lead to what we're talking about, the heart attack, right? And so the lower the LDL, the better. And in fact, if you have heart disease, we want it as low as we possibly can. Lower than 70 or below is what we shoot for. And so if you do not have heart disease, then we tend to tolerate a little bit higher level, maybe around 100 is what I really shoot for in my patients. But if you have diabetes, which we consider a heart disease equivalent, we tend to really get it as low as we possibly can. In that case, really 70 and below. So definitely don't go by the total cholesterol alone, but certainly, like is mentioned, you want to know the breakdown. You want the HDL to be as high as it possibly can, and the LDL to be as low as it can. So how can you lower the LDL? Some of those measures that was mentioned for the HDL can work just as well for the LDL. But most importantly, it's really what you eat in terms of really staying away from the saturated fat, all the good stuff, really. I mean, when you're talking about the hamburgers, all the red meat, they all have a very high content of saturated fat. And that's why they taste so good, by the way. So essentially, if in doubt, if you see a long line, if you're driving on the street, you see a long line, just stay away. Just go to the store where there's not a long line. And that's always a safe bet, right? But definitely you want to also exercise. Exercising will definitely help you keep your weight under control, and certainly doing those measures will help you. And also will the different particle level in the HDL that also can be influenced by those staying away from those saturated fat, and also eating some healthy food that rich in antioxidants. A lot of the greens, the vegetables, those will certainly help give you a healthier level of LDL.
Oh, good. So that kind of, excuse me, it kind of brings up the question that I wanted to ask. Actually, a couple of things. Y'all had mentioned about, of course, if you don't already drink, don't start drinking. But what I know, a lot of people out there like to drink, but I mean, how does alcohol affect your heart if you consume it too much? You know what I mean? I mean, you don't have to go through all the mechanisms, but just in general, for those who like to overindulge, how does that really affect the heart muscle? Does it really make it weaker, or irrespective of the arteries, what about the actual heart?
No, absolutely. I guess I'll start, and you can add to that, Dr. Corrielus. Pretty much, it's always the reason why I say it's always better not to drink if you're not a drinker. Not only the addiction part, but every time you drink, you actually damage some cells in your head, in your brain, and in your heart. However, we have so many cells we don't use. Okay, so that's why it takes years to actually get the effects of drinking heavily every day. So for men, it takes longer. Like, for example, men, it may take 30 years for the liver to get damaged. Women, it usually takes them less because they have smaller livers, depending on the size of the woman and the man. So, but the brain is the same way. You drink heavily, you kill more cells, and then you get to the cells that you actually need. And that's why people start getting, brain damage as well. As far as the heart, it is actually more sensitive with heavy drinking. In fact, it doesn't take years; it takes months. But the amazing part, if you drink heavily, what happens is that the cells get damaged, but not completely. It's actually amazing, and we don't understand it that well. And Dr. Corrielus can add to that. One of the most amazing things that happens is that when alcoholics who drink heavily, patients who drink heavily, stop drinking, most of them, their heart actually goes back to normal. So the heart can actually get damaged to the point where it becomes weak, which is what we call heart failure, systolic heart failure. And it's actually a very common cause of a weak, systolic heart failure. The most common cause is actually heart blockages and heart attacks. And second most common cause is uncontrolled high blood pressure. And then there's other random causes. Well, alcohol is a very common one, especially in developed countries like the US. And it's one of the ones that actually reverses. And, I can't tell you the time that I figured out after the fact that my patient was really an alcoholic and didn't just drink a little bit. After they stopped drinking, a year later, they're like, how did your heart recover? 6 months later, not right away, what did we do differently? And then I realized that they were drinking heavier because, patients usually, it's an intrinsic thing. Like if you drink heavily, you're not going to say how much you're drinking, right? You may say, oh, I drink a beer once a day or something, and it's usually more than that. But it actually recovers. That's the good thing about it. But yeah, drinking heavily does damage the heart. And that's why we don't recommend it if you're not a drinker, because we don't want to get to a point where you're damaging your heart, not protecting it. Other heart failure causes that actually are reverse also are patients that get it when they're pregnant, since we're talking about women. So what we call peripartum or postpartum cardiomyopathy, a lot of those patients also recover, which is very amazing to me, But why not other causes of heart failure? We really don't understand why it's alcohol and, peripartum and postpartum cardiomyopathy. There's a lot of theories, but it hasn't really been proven. And there are patients that don't recover actually once they stop drinking, for example, or once they give birth. So it just depends on the patient too. And, going back to the LDL, so one thing I wanted to add that, I actually didn't learn till I was in, cardiology fellowship really well. So that's why I wanted to point that out. But, you really need to cut down on carbs to lower your LDL and triglycerides too. So about actually 20 to 30% only of the cholesterol you eat is actually your total cholesterol, your LDL and your total cholesterol. The rest of it is actually your liver making cholesterol from carbs mainly, right? So that's the genetic portion, so that's why you'll have obese patients that don't actually have really high LDL, and you have really skinny patients that have high LDL. They're like, I never eat anything fried, I run. It's because they're eating pasta, they're eating bread, they're drinking milk. Milk is also carbs. And all the extra carbs you don't burn, what happens is at night especially, your liver wakes up and says, hey, what sugar do I have? And I'll make cholesterol. So keep in mind, to control your LDL, you also need to cut down on carbs big time. And that includes milk, includes sugar, includes bread, includes, pasta, and especially in diabetics, That's why all diabetics have elevated LDL and triglycerides.
Okay, I'm gonna let you answer that one because we have some other questions coming in, and I know I didn't want it to be an extra long show. So I have Katrina, and I think Katrina and Pat could possibly be closer. Clean eating, better for heart health, eating raw fruits and vegetables, and then avoid red meats altogether. He tends to buy 93% lean and add olive oil to cook and drain off the excess fat. Alternatives to fish. I do not care for seafood due to being strong in fishy taste. I use a lot of baked chicken and turkey. So for me, I became a vegetarian because I do, for personal reasons, but also just the vegetables and stuff. I know that could be better. And I've heard that raw, vegetarian, vegan, plant-based diets are more heart healthy. So I'd love y'all's take on that. And then Victoria, I didn't forget about you too.
Do you want to go ahead, Dr. Corrielus? Since I'm like, we're going back and forth.
Can you repeat that for me? I'm sorry. What was it?
Plant-based diets, clean eating, avoiding red meat kind of thing, vegetables, all that.
Yeah, no, absolutely. I think there's no question about it. Plant-based diet is really what is more physiologic. It's more physiologic, essentially, in terms of really helping for a healthier artery and less plaque building, right? So I always recommend to my patients to eat. In fact, I simplify my recommendations for diet in terms of making it lean and green. So I tell my patients to eat lean, right? Lean, what does that mean? You want to avoid some of those, the red meat, some of those meats with high saturated fat, go lean. Essentially with something that like the fish or the chicken that has less fat in it, less saturated fat in it, right? So that's the lean part. And the green essentially is really all the plant that you can get out of your garden. If you can get it from the garden into the kitchen to the table, that is really the best way to go. And so essentially, and a lot of times, I tell patients to really avoid anything processed. And when it's processed, it's also not good because remember the whoever is processing it, whoever in the food industry, they are in the business of really selling. So they will do everything to make sure that it's well preserved and that it tastes good even after it's been on the shelf for so many months, right? So as a result, there's a lot of chemicals in there, preservatives that is put in there, and when those go into your body, and they're going to your body's going to react to it one way or another, and that's where you're causing an inflammatory milieu, and so when there's inflammation is what is the nidus for plaque building, and that's what's really pump and accelerate the atherosclerosis and heart disease and heart attacks. So when you go plant-based, you really stopping that process. You're stopping the inflammatory process because again, it's more physiologic. It really is the best way to go to being able to go with green as much as possible and avoid some of this processed and high saturated fat food. And I just want to, Dr. Diaz made a good point with regards to the some of those things that we eat that leads to LDL elevation in the LDL levels that's being produced by the liver. One of the things with the alcohol that we need to be aware of is that alcohol is sugar, right? There's sugar in it, and it is converted into fat. It is converted into fat in our body. So a lot of times, we not aware of that. A lot of people who drink can have elevated cholesterol as a result, and that could be one of the pathways of developing atherosclerotic disease. And also people, as was mentioned, the cheeses, right? We keep going back. As mentioned, milk, but in particular cheese. A lot of times people don't make the correlation. I have one of my patients, whose cholesterol was really sky high, and had to be on high dose statins and trying to control it, and still we were having a hard time, and comes to find out that she was a big avid cheese lover, was eating cheese really on a regular basis. And so that was really what was contributing to it. So definitely what we eat is very important. And that's why, again, we call heart disease a lifestyle disease. It's really, if we look at our lifestyle, we look at what we eat and, how much we exercise and those kind of things, we really take good count on those. We'll figure it out more often than not, what's leading to it, and we can turn it around.
Right. So don't cut the cheese.
Not cut the cheese.
I'm
Yeah.
sorry, I couldn't help it. I'm sorry.
Stay away from the cheese.
Okay, I have another question. And then I have a really important question with COVID, but I want to get Victoria's question out the way, and then we'll be mindful of the time after that. Um, with categories, when discussing the normal diastolic and systolic numbers, what is the current standard? The information on this causes a lot of confusion as to what the normal range is. So I guess just briefly, can y'all just briefly say what blood pressure, systolic and diastolic numbers mean, the top number, the bottom number, what the heart is actually doing in systolic versus diastolic. And then I have one final question, and we can start to wrap it up. Mm-hmm.
No, absolutely. That's a good question because you really should know your numbers and understand them. So the rate has kind of changed not too long ago. They're more strict because we were catching people later because hypertension is a silent killer. So the numbers in the last couple of years changed to be more strict. So you used to see that hypertension used to be counted like a systolic had to be 140 or above, and diastolic had to be above 80. And now we actually start calling hypertension where we say, okay, you need to eat better. You really need to watch the sodium. You need to lose weight if that's an issue. Exercise, all that stuff, pretty much at 130. And same thing with 80, right? And again, do we treat at those numbers? Not necessarily, but the reason we started doing that is a lot of studies showed what would happen is those young patients, right, patients in their 30s, 40s, 50s, come to the doctor's office once a year, maybe once every 3 years, and they're told, oh, your blood pressure is fine, it's 135 or 80, you don't need anything, and then they come back with really high blood pressures for months or years, and they already have, a thick heart, LVH, which happens with, left ventricular hypertrophy, which happens when you don't, have controlled blood pressure for a while, eye problems, kidney problems, and so we're more strict. So we like to see the numbers. Top number around 130 or less, bottom number, between 90 and 130, bottom number between, 60 and less than 80 or less. Again, that was less strict before. It was 85 and higher, I believe it. I can't keep up with every year, but every few years it becomes more and more strict. Now, these numbers don't apply to everyone. We're more strict with patients with heart failure. We're more strict with patients with diabetes, heart attacks. So people have had, a ruptured aorta or something, so these don't apply to everyone, but that's the general consensus. And so, we always recommend lifestyle changes first when you are first diagnosed, unless we know there's no way, like the blood pressure is too high and we have to treat. So yeah, those numbers are like moving targets, but I think in general, if your top number is staying above 140, bottom number staying above 85, and no matter what you do, you probably need medicine. And again, your doctor should decide that, because we don't go by one blood pressure. We really need 3 different high blood pressure on 3 different occasions to say for sure, hey, you actually need treatment, or hey, you can control this with lifestyle changes.
That's excellent. Okay. How good are veggie burgers? Are veggie burgers good? They're good, Kasali.
they're actually good for you. I think it just depends on, I think the people who just need to be careful are people with high blood pressure and heart failure, because they do have sodium. So, anything processed, even veggie burgers, you just have to look at the labels. But obviously, if you make them yourself, it's different. But look at the label and see how much sodium is on it. If you have heart failure, we usually recommend 2,000 milligrams or less a day of sodium, which doesn't sound like a lot, and it's not a lot. Obviously, if you have hypertension, we recommend 3,000 or less. So, you just want to, make sure you look at the sodium content. Anything that's pre-made or processed usually has more sodium than if you make it yourself.
That makes sense, yeah. And then Patrick says, so shop outside the aisles at the grocery store. Yes, because that's where you find the vegetables and the fresh stuff, right? Absolutely. So I wanted to just switch gears really briefly, y'all. We're living in a pandemic. COVID is everywhere, okay? We typically associate COVID with people with respiratory issues, but, a lot of people apparently have heart issues after COVID. So do y'all, I can't really speak at all. I know it is out there, and can y'all shed some information or some light about that, how COVID can affect the heart if not in the immediate long term? Or do y'all know of anything with that?
Yeah, I can touch on that a little bit, and of course, Dr. Dia, you can come in as well. What we know now in the acute setting is that COVID does affect the heart and can affect the heart in ways as if patient is having a heart attack at times. Okay, so COVID has been quite more of an overwhelming inflammatory disease, and the inflammation is pulled back. That is, it's likely that the patients can have not only evidence or presentation of pulmonary embolism, but also people are presented with stroke and clinical evidence of heart attack. Okay, so that is in the acute setting. That's in addition to the pulmonary manifestations and other end organs manifestations as well. But we do know that from a cardiopulmonary standpoint, those are some of the manifestations. And so it is actually not uncommon that people will in the acute setting, depending on the clinical manifestation, come out needing to be on anti-thrombotic agents, at least in the short term after the acute infection, just to make sure that they are treated for the acute event and also for to prevent any further thrombotic events from developing. As far as the long-term effects, we obviously don't know yet. The verdict is still out. That how much or how far the extent of the manifestation to the heart is or will be, and so in fact we practice very close monitoring of those patients who have developed the COVID, very closely monitoring the heart function and really try to keep a close eye on their inflammatory profile. Their SED rate is one of the markers that I kind of use to kind of help to gauge how they're doing post-COVID infection. So, yeah, that's Dr. I don't know if you want to add some to that, Dr. Dia.
No, absolutely. There's a lot of things we just still don't know about COVID. We've only had about a year worth of data from all over the world. So there's a lot we still don't know. And I think part of it is why some people get really sick and some people have no symptoms. There is a genetic predisposition. We really don't understand that well yet. But I can tell you that, having heart disease doesn't really put you at risk for catching COVID per se. It doesn't necessarily affect your immunity. But remember, most people with heart disease, whether it's heart attacks, heart failure, also have diabetes. So for example, diabetes, having diabetes, especially if your sugar is not controlled, but in general, puts you at risk for catching all kinds of infection, especially COVID. Even eating sugar, when you eat sugar, even if you don't have diabetes, for 6 hours, your immune system is down. So imagine when you have diabetes, which is like chronic high sugars. But if you do catch COVID when you have heart disease already, right, then you're at risk for having worse outcome. So, for example, if your heart function is already low, it's already 20% when it's supposed to be about 50%, and you catch COVID, well, COVID can affect the heart muscle and make your heart even worse. And so if your reserve is not there and you have more damage, you may actually not recover and your heart may not recover. And then, most patients that actually get COVID have lung involvement, whether it's just bronchitis, whether it's pneumonia, whether it's both, sinusitis as well. That's actually more common than heart problems. But unfortunately, I have seen patients that have had clots in their lungs, which are called PEs, pulmonary embolus, with fluid around the heart, which is, a pericardial effusion, with heart attack, with the heart being weak in the same setting, in the same hospitalization. And one of my patients who's only around 50 survived. And it's amazing that he survived, but I think it's because he was only 50, but he's still now 10 months later, still having shortness of breath, fatigue, never went back to normal, can't go back to working. So other than, Dr. Corrielus, pretty much, mentioned all the complications, but what we worry about the most is when the heart muscle itself gets inflamed, myocarditis, which can cause the heart to be really weak, but also can cause the heart to stop even if when they go home. We worry about bad rhythms that stop their heart. I've only thankfully only seen a couple of patients like that. I think I've seen more weak hearts, like which is what we call heart failure, mild heart failure, and also arrhythmias, like fast heart rates, mostly fast heart rates, some slow heart rates from COVID, as well as fluid around the heart, which is the pericardial effusion and the clots in the lungs. So those are much more common, but unfortunately, it does affect the heart. So if you already have heart problems, that's why you're considered high risk. If you already have heart problems, you're more likely to have more heart problems if you catch COVID. So I tell my patients, this is how I encourage them to get the vaccine. You know, you don't really have a lot of reserve, so you can't get hit with COVID because you may not make it since you already have problems. So it's very, very important. I'm glad we're discussing that.
Oh, thank you. This has been really great. I wanted to start transitioning now. And so, obviously there's so much more that we could talk about the heart. It's just so much out there and so much information. The heart is so important. But if these folks out here who are listening now and on the replay wanted to just find out more about what you all do, how can we get a hold of you? And then what I'll do is I'll type your URLs in the comments, or someone can type them in the comments. So how can we get a hold of y'all?
So I'll go first. So I'm on Facebook, Instagram, Twitter, and LinkedIn. So you can catch me on any of those platforms. Pretty much just dash Dr. Diaz Smiley, DIASMILEY. I check all those messages pretty frequently. Also, I do have a website. You can access my email there, or just message me directly from there, drdiazsmiley.com. I am currently in Atlanta and, accepting patients. I don't do any concierge work, at least not yet. But I'd be happy to, see if I can help you. One thing I want to add, Dr. Dietrich, there's some questions about red meat. I think, red meat and olive oil. I think, because there's a bunch of questions. I don't know if we addressed them because we kind of went back and forth, but
yeah.
There's actually, so if you eat a teaspoon of olive oil daily, it decreases your risk of heart disease in general, whether it's heart blockages, heart attacks, stroke, by 15 to 20%. Very, very important. So that's why olive oil is your best friend. You just can't, deep fry with olive oil, but that's fine because you're not supposed to eat deep fried food anyways. But put it in your salad, put it in your baking, grill with it, put it on your salmon. It's really good for you. And then as far as red meat, there is actually an association. There's multiple studies that show that eating red meat, if you had a twin, I told my patients, if you had a twin, right, that had the same genes as you, and they ate red meat and you didn't eat red meat, they're at least 10% to 15% more likely to get a heart attack or a stroke compared to you. Okay, so I'm not, I tell my patients I can't stop you from eating red meat, but you can definitely cut down. So instead of eating it every day, which it's really easy in this country, right, to eat red meat every day, very easy. So instead of every day, do it once every 2 weeks or do it on occasions, and develop more of a plant-based diet because there's a lot of evidence that helps. And then fish. You just can't eat fish every day because of the mercury, but fish is good for you. And chicken and turkey are better than red meat, but still not every day because it's animal fat. So have days where you don't eat any animal fat.
Excellent. I'm glad you said that. Yep. Dr. Corrielus, how can we get a hold of you?
Oh, I am actually on social media. Actually, I am directing my patients, especially men who actually want to practice prevention and really get together with other men to help you through that journey. What we said here, we said a lot of stuff to help you to get to a better health, but none of them are easy, right? We're telling you to get rid of red meat. What? Are you kidding? Yes, a man would say, right? I understand. I mean, that's tasty. That's good stuff. We just eat carrots and herbs. I mean, who's gonna do that? So definitely, I think it's very important to be in a group setting where you are supporting each other, so that you talk to other men who are actually on that journey with you. That makes it easier. So then you can find more clever ways to cook your vegetables. That makes it just as fun as eating the steak and not put you at risk for the next heart attack. So I am I invite you to join me at my Facebook group. It's www.blackmendo.club. www.blackmendo.club. And there you will be able to get information about me and about how to lead a better heart health. I'm
Wait,
also
you kind of broke up. I didn't hear Black Man what? I couldn't hear that.
blackmendo.club.
Do.club?
Yes.
Okay. BO.club.
That club. Blackmendo.club. And
Okay.
I also can be reached at my website. My practice website is corrieluscardiology.com. It's again corrieluscardiology.com. My practice is in the heart of Philadelphia, and we do concierge. We do all different services at my practice.
Excellent. Thank y'all very much. And I just can't, thank y'all enough for taking the time and joining me tonight. And all of y'all, please reach out to these docs. They have a lot of great information, and it's for you. It's for you to help strengthen your heart. And as always, I talk about relaxation, techniques. These are things that are going to help you relax and help manage your stress. So I definitely encourage you to pick up my journal, my coloring book, or my book, or of course, continue to listen to my lives, listen to my Relax Well series every week at Wednesday at 8 p.m. And I'll share with you all different relaxation strategies, different topics in relaxation, and different health topics for y'all. But for those of you out who are wanting something for free, I have 50 ways to treat yourself well. Go to that website, 50ways-to-treat-yourself-well.com. I'll place that in the URL. And no matter what your budget is, you can find ways to treat yourself well, learn how to manage your stress better, and improve your heart health. So thank y'all once again. I'm Dr. Dietrich Gorman, America's Relaxation Doctor, and I will see y'all next week for another episode of Relax Well with Dr. Dietrich. Thank y'all.
Thank you all. Thanks, Dr.
Okay,
Dietrich.
bye.
Take care.
Bye bye.
Okay, bye, y'all.